Hello, hello, ladies of Beyond the Doctor's Lounge. I am so excited because we have an encore presentation by Dr. Jeannie Lawrence, our esteemed life coach, board certified psychiatrist, and my personal coach. So I am so happy. Thank you so much, Dr. Jeannie, for being here with us this evening.
I am thrilled to be here. Thank you so much, Sandy, for inviting me, for putting this together. This is going to be great.
Yes, I'm really looking forward to it. Thank you so much for agreeing to be on. I reached out to you a week or two ago because I was just thinking about burnout. I was thinking about career pivots. That's what the group is about. It's about women going through the career transition from clinical to non-clinical or some mixture of the two. And one day I was thinking about my own journey and how, as I was transitioning from clinical medicine and healing from burnout, I found myself in a situation that I did not expect. And I found myself having to deal with the aftermath of burnout and adjusting to a lower level of stress. So that's why I asked you if you wouldn't mind coming to chat with me and maybe talking to the group about this topic, because I'm sure I'm not the only one. And for the women who are pivoting right now, they might find themselves in the same spot. Dr. Lawrence, can you tell me or tell us what burnout is?
Yeah. So I'll start with kind of the dictionary definition, right? Burnout is defined as a work-related, emotional, physical, mental exhaustion, right? That comes from under stress for prolonged chronic periods of time. It has 3 hallmark symptoms, right? You guys probably already know this, but there's the emotional exhaustion, cynicism or detachment. So in other words, starting to develop a kind of cynical and detached attitude towards work, patients, even colleagues that wasn't there before. And then also feeling ineffective, right? Like the work that you're doing doesn't matter anymore. So that's kind of the dictionary definition. I would love to get into what that actually looks like in lived experience. And I know that you've experienced this. I've experienced some level of it. I'm sure there are women in the group have as well. And sometimes the dictionary definitions are helpful, but also kind of miss the mark a little bit in terms of like really describing the lived experience. But that's like how it's defined and what we see.
Okay, great. And how can we recognize these signs in ourselves or even in colleagues who we are close to who may be getting into burnout, mainly in ourselves?
Yeah. I almost want to bounce this back to you a little bit, Sandy, like again, kind of sharing the lived experience and like what it really looks like to feel that burnout. But I know that when we started working together, some of the things that you shared, and I've experienced this as well, for certain, is the exhaustion, right? It's like giving all that you can essentially at work, being completely drained and having nothing left to give after work. That becoming such a cycle that even at work, you're having less and less to give. So that's that exhaustion that you feel in your bones, and that doesn't go away with like a nap or even a day off or a weekend, but just seems to progress, right? I think another thing that we see, or that I've seen, and maybe you can speak to this a little bit more, is like the feeling of being trapped, right? Like essentially feeling like you're kind of locked into a situation, a job, a life that no longer feels like is yours. And it's a really painful feeling to feel like everything you're doing, you have to do, as opposed to a life where you're doing things that you want to do. I remember feeling that way. I remember you sharing that with me as well when we first started working together, that between work and all of the responsibilities of life, right, that everything was kind of pulling you towards, again, what you had to do, and there was nothing left for what you really wanted to do. And that's a really difficult place to be in, and creates, I think, more of that physical exhaustion, but also just emotional exhaustion as well. I'm going to pause and let you jump in there a little bit too. Like, how else did you know you were burned out? What was your experience?
Yeah, I think for me, the first thing I recognized probably with burnout was the sense of dread in going back to work, because I do remember in my early days of being an attending that I used to tell people I got the best of both worlds. I have a week off, and then when I go back to work, I love what I do. And I can remember not feeling that same sense of excitement or looking forward to going to work. So that was one of the first things. The next thing that I noticed was the inability to recuperate. I mean, I would think that after being off for a whole week, that I would have bounced back. I'd be ready to go bouncing back onto the wards. But yeah, after several years, that was no longer the case. And the other thing I noticed, in the first 1 to 2 days off, I would be just good for nothing. I would just be so exhausted. I didn't want to go anywhere. I didn't want to do anything. Whereas before I entered burnout, I would look forward to that first day off. I would clean my house and, watch YouTube videos, do some organizing. The next day I would, work out and do, go to the beach, things like that. But yeah, as I got into the throes of burnout, the thought of being able to say, go to the beach or something like that, it just wasn't anything I wanted to do. It felt like going and taking a trip to Antarctica. It felt that difficult.
Yeah. That's really powerful to kind of hear in your own work, like what that really looks like. Yeah. Not recuperating, dreading going back to work, days off just kind of spent either good for nothing, essentially, because you're so drained. And then the other half of the time dreading the going back to work, right? And kind of psych yourself up for yet another week of work. I think it's really painful when, especially what I hear is like, this is a change from like what it used to be. Like, I used to enjoy work. Like, this is work that I used to love doing. And so if you notice that as a change, just as something for the women who are listening, if you're trying to pinpoint where you are, or if this is you, like, if you're somebody who used to not feel this way and you have noticed this shift, like, yeah, it may be burnout. I was wondering too, Sandy, about like the cynicism and depersonalization. Those are like, they're words, but like, what did that really look like for you? Like when you're actually experiencing burnout?
Yeah, I mean, I definitely started experiencing that as I got late into my burnout. And yeah, just even thinking back on it is so difficult because I've always been a person who wanted to help, who wanted to make a difference for my patients, like so many of the women in our group, probably all. And we all go into medicine, wanting to save the world, wanting to save people. And so as I got to the place where I was starting to feel a sense of dread and walking onto the floor, a sense of dread and opening the door to the patient's room, not knowing what was going to greet me on the other side, not as far as the medical side of things, but I just didn't have the bandwidth to deal with the different personalities, to deal also with the deep emotions that our patients and families were experiencing. And that just got to be more and more difficult for me as I went deeper into burnout. I was more concerned at some point about shielding myself. In a way, I felt like my white coat was a bit of a shield. And I just started enjoying patient interactions less and less. Not that I never did, but I didn't walk away with the warm fuzzies as often as I used to. And also my interaction with colleagues and also with the nursing staff. I was definitely a very collaborative person, but that just got to be more and more difficult. Instead of walking onto the floor and saying, here I am, I was kind of like tiptoeing around the back just because I just didn't have the bandwidth anymore. So that's what getting deeper into the throes of burnout looked for me. That's what it looked like for me. Yeah.
Thank you for sharing that. I know you're here to ask me questions, but I think like in your own words, it's like way more powerful than kind of the dictionary definition. And if someone sees themselves in what you described, right, then this is for you. So
exactly. This is definitely for you. And what, Dr. Jeannie, do you think puts doctors, and especially women doctors, at a high risk for burnout?
Yeah, it's so interesting, right? We're at this interesting intersection as not only physicians, but women physicians and just women in general, right? There's the systemic stuff that we know about, right? We're working in a broken healthcare system, asked to do more and more with less and less. There's all the things that we know about the EMRs, the administrative burden, scope creep, the loss of autonomy, like all of these insurance battles, like all of this stuff that's systemic and bigger than us, that's at play. But then also there's certain things that we deal with specifically as women, right? Like men in medicine, of course, deal with some of the systemic things as well. But then we're also dealing with sexism and gender bias, right? having our authority like questioned in ways that our male colleagues may not experience, or being called by our first name, right, as opposed to doctor, or dealing with sometimes the bullying of like other women in healthcare, nursing, or whoever the case may be. All of these things that come with specifically being a woman in medicine. We know about pay inequality and trying to rise, up the ladder, right, and do good work and that not being recognized. The struggles then, I think the other, right, is that after our clinical work is done, we have a whole other role outside of medicine, a whole other set of roles as mothers, wives, caregivers, all of the above, right? It's like from one long shift in the hospital to another endless shift at home, and this is our family and we love them, and yet like we know that the bulk of the burden of household duties and childcare also falls on women, right? And there's the lack of support, for some like within the home, and then also for others just like systemically, like there's not adequate leave, there's not adequate paid leave, there's not adequate childcare, and so it's really like the perfect storm right there that puts us at this high risk. And then I want to speak to also, while there's all this systemic stuff and home life stuff and all of that, I think that medicine called in women like us who are altruistic, givers at heart, hearts of service, like who naturally give and take care of others. And of course, that's praised and, that's nice for a certain period of time, but like, chronically, right, we tend to neglect ourselves in that process, right? Putting ourselves last, detaching from what we truly desire, detaching even from our own needs, right? And so this kind of self-selects for us. So those of us who might lack boundaries or a bit of people pleasers, right? A bit perfectionistic, and those patterns of kind of overwork and self-neglect over time also contribute to creating this perfect storm that puts women physicians at this increased risk for burnout. So,
yeah. I can remember, Dr. Jeannie, when I first started working with you, that you had me take an inventory, and I can remember you telling me that my results show that I was very much deep into occupational burnout, and I remember being in that place. And I think for me, at the height of my burnout, I was also dealing with the illness of a parent. My father, got sick. He was right there hospitalized at my hospital. I am very thankful for the leave and the paid leave that we have and in my hospital. So that really helped. But yeah, at that point, it got to be really difficult to be working late ER shifts and worried about what's going on with my family and worried about if the caregiver was going to leave in the middle of the night, because at that point, we didn't have steady care, for my father. And thankfully, now we have a stable team. But before that was the case, my mind would be at work and with, my family situation. So I know it's the same for many women physicians out there. And how does burnout affect our relationships, our various relationships as physicians, and particularly women physicians?
What I've seen and what I've experienced. So burnout, again, by dictionary definition, is an occupational phenomenon, right? It's like we usually associate it with work. I tend to think of it broader than that in terms of life as well, because the effects can be really far reaching. To answer your question, what I see is that after a woman physician is kind of giving her all again in the workspace, burned out, there's very little to give when she gets home to her personal life and to the people in her personal life, the people that she loves them. I've heard it. It's kind of like the work gets the best of you, and then everybody else just kind of gets the rest of you, and you get none of you, right? And those relationships, I mean, to be more clear and specific, right? There's little bandwidth for deep connection with loved ones, husbands or spouses or partners, a difficulty with being present, like with children, like even if you are fortunate enough to be present physically for the moments, right, that matter. Sometimes, just like you said, your mind is split between work and then in this personal life. And so that lack of presence. And so these moments are kind of passing by. This can be said for, parents and other folks that we love and that we want to take care of and we're doing our best by, but like you can imagine, like you might be shorter fused, for example, right? You have less bandwidth, you have less mental presence. And so, yeah, I think that's there's clear it's clear that these relationships can be impacted. Same goes for like work relationships as well. You talked about like just less bandwidth, like to be as collegial and as collaborative as your baseline, right, with the folks that you work with in the hospital. I think those relationships can also kind of feel that burnout as well. And so, yeah,
Absolutely. And our group in particular, Beyond the Doctor's Lounge, we focus on non-clinical pivots, whether it's completely pivoting from clinical practice or some combination or hybrid. And so for women who just decide to cut back on clinical practice, is that enough to solve their issues with burnout? Does that fix the burnout?
So from what I've seen, I think it's important, first of all, like if you're burned out and you can take time away from clinical practice, I recommend it. Your question was, though, is that enough? And I think the answer in many cases is no. What I've seen, and I'm going to bounce this back to you again, but like what I've seen is like there's the time that we need to take that mental break from, or that physical break from clinical practice. But the question becomes like, what are you doing with that time? I've worked with women physicians who were able to take time off. And one of the things they noticed in that time off initially, like before we started kind of getting into the coaching, is that their anxiety actually went up. Like they actually felt worse, right? Because their brain and body is like stuck in fight or flight. If you think of burnout as like being like in a chronically stressed state, if you stop working, if you take a prolonged break, that's great, but your body's going to go into a withdrawal almost, right? That constant adrenaline, that constant stress state. And so that in and of itself, the time away can feel super uncomfortable. And so I think it's really important to not only take the time away if you can, but also be intentional with the way you spend it. And we can talk more about that, but like that is really what matters, right? It's not just about getting more sleep, right? We already talked about the exhaustion of burnout being something that you don't recuperate from, like with a nap or even a long weekend or even a week off between your shifts, like you described, right? It's deeper than that. And so it's not just about getting more sleep. It's about being really intentional about the way you use that time away so that it's productive and starts to help you rebuild so that your next phase can be different and better than the one that you're exiting.
Yeah. And the effects on the nervous system, that was what triggered me to, ask you to come on and speak to the ladies, because I was reflecting on my own non-clinical journey, and I went from high stress to a very low stress job, extremely low stress. And yeah, I really felt this. I felt this hangover, this after effect of that heightened level of stress and cortisol that I was used to, and I did not know what to do with it. And I remember reaching out to you, and it got to be difficult to rest. It was difficult it was difficult for me to realize that I was in a safe environment, that there wasn't going to be a cold blue, I wasn't going to get a call that, there's some bad news regarding my patient. It just really took a time of adjustment. And how can women navigate their way, whether they're taking a break and going back to full-time clinical practice, or whether they are pivoting or taking a break non-clinical to go back in a year and a half? I heard a lot of physicians stay out for about a year and a half to recuperate. What are some things that they can do to help with that transition and to help their nervous system to settle down?
Yeah. I think first is awareness. I'm really glad that you are bringing this conversation to the group, because I know that a lot of times what we're thinking, like if you're in the throes of burnout and you're thinking that I can take a break, right, and I can pivot, that's going to be enough. And it can be like very disorienting and kind of confusing, right, to have that break and then to realize that, again, like it's super uncomfortable in many different ways. And so just the awareness of like what's happening, right? You've been under chronic stress for a prolonged period of time. It's going to feel like a withdrawal of that state, and it's going to feel uncomfortable. So anticipating it, in other words. And so it's not taking you by surprise. Something that you and I coached on, like in your transition, I think would be helpful is, in addition to that awareness, is and recognizing what's happening kind of physically and biologically, is like what's happening like mentally for you during that time, like what's happening psychologically. You can recall, and help me remember this, but like when you went from your clinical position to that low stress non-clinical position, that was incredible. But like you had a lot of thoughts, right, around your value and your worth and the amount that you were being paid to do what felt like very little. And we had to, as compared to like, running around the hospital with your hair on fire, right? And we get into this space where we really attach our value with like how hard we're working. Like, and if we're not working extremely hard and constantly and consistently, then it feels like we're not pulling our weight, and all of the mental chatter, all of the drama start that essentially is telling us that we're not doing enough, right? And we are not enough if we are, if we're moving anything less than 200 miles per hour. And that really stems from the beliefs that we have about what makes us valuable and worthy. And that is kind of the work that we have to do in coaching to kind of untie our worth from our worth. And you had to realize, and I've had to realize this too, that like the decreased pace, the slowdown that you are enjoying at that point doesn't make you any less worthy, right? And that you absolutely have earned that. And that also rest is not something that you have to earn in the first place. There's these patterns that we get into that are driven by our core beliefs. And I think that is what keeps us in that kind of heightened state. And it can be really helpful to work with an outside perspective, whether it's coaching or therapy, whatever your choice is, to start to unravel, to understand some of that and start to unravel some of that so that you can rest without feeling guilty or like you have to get back into motion right away.
Yeah. And I think, I know we're coming up on the hour, but I think that what you said is so important for us women doctors to hear and to embrace, and just, to realize that yeah, it could be a shock. It's going to be a shock to your system. And you do deserve to rest. You deserve that change of pace. And it's okay. It's okay for you to rest. It's okay for your hair not to be on fire. Just because we lived that way for many years doesn't mean that we have to continue on that way forever. So thank you so much, Dr. Jeannie. I know we're coming up on the hour. So as we leave, do you have any parting words for the ladies in our group?
I think the last thing that I just wanted to plug in there, like to answer that last question just a little bit more, the awareness, the untying our worth from our work, but then also like starting to ask questions that I think we don't get asked very often, which is like, what do I really want? What matters to me, right? What are my values? What did I used to love to do before I started down this path? How can I start to dream again? Those are questions that we have to ask ourselves in this period to kind of connect once again to the women that we are at our core, right? Not just the doctor or the mother or the wife or the caregiver or any of those things, but like us as like human beings, like what do you want? And starting to believe again that's possible. That's harder than it sounds. I've spoken to many women physicians and coached many women physicians, and that initial question can throw us for a loop sometimes, because after being chronically overworked and neglecting ourselves and burned out, and then also trapped in these situations that make us feel burned out, right? We lose touch and sight of like what matters to us and the kind of life that we once thought we could have. And so reconnecting to, again, what we desire and making a commitment to start to go after that in small baby steps is super important. And I think a big part of this healing process, and making sure that your next chapter is much better than the last chapter in whatever way that feels right for you. So, yeah.
I agree. We don't want to jump out of the frying pan into the fire because we're not addressing, what's going on with ourselves emotionally, mentally, and physically. And coaching is a huge part of that. And Dr. Jeannie, how can the ladies get in touch with you if they're deep in the throes of burnout, if it's affecting their relationship, and they want to enter the sanctuary and start dealing with that, whether pre-pivot or post-pivot? How can they get in touch with you?
I'm on Instagram, Dr.Jeannie Lawrence MD. You can follow me on my website, JeannieLawrenceMD.com. I'll leave all of that in the chatter, wherever this is going to help me out. But yeah, I'm available. And I think that wherever you choose to kind of get your support, you're worth it, right? You're worth that investment of time, right? And just space that's just for you. And so, yeah, I'm here. Dr. Sandy Coleman is here helping women physicians through career and life coaching as well. And so I think my final words is that your life is worth it. You are worth it.
Worth it. Yes. And Dr. Jeannie, I sure hope we can have you on again, because I think that there's a part 3. We have part 1, this is part 2. And I think there's a part 3 that's still left for us to finish up. But thank you so much for your time. Thank you for being here with us again. And ladies, really, I hope you take everything Dr. Jeannie said to heart. Remember, you're worth it. You have met her for other people. You have gone through sleepless nights. You missed important events in your family, and your wellness is worth it. And it's also worth it to the people who love you. Thank you so much, Dr. Jeannie, and everyone have a great evening.
Thanks for having me, Sandy. Bye.
My pleasure. Bye-bye.